Hi, everybody. My name is Shelley Milosevic-Johnson. I'm the Director of Client Services for Purple Binder. And I'm going to start off like we kind of started the whole evening off, where I'm going to ask you to imagine with me, if you will, a homeless mother with 2 children who's just left her home because of a domestic dispute with her husband. Or a veteran who's new to a city because he was recently promised a job, and once he arrives in that city, there's no job ready for him. So I ask you, where do these people turn when they have no money and have no support network in these places where they find themselves? And how do they or I, as a social worker, know where I should be sending them? I don't know what all of the community resources are either. And so for those of you who have ever done case management, I'm not sure, I sure have, it's funny because we social workers and case managers carry around paper binders, literally, with handwritten notes and outdated information and coffee stains. And so that's the reason why Purple Binder is named Purple Binder. Our co-founders saw a very, very messy Purple Binder and decided that that was the one thing that they wanted to replace with our product. And so that's how we got our name. So under the ACA, we have a mandate actually that we need to be considering how people are staying healthy outside the 4 walls of our community health centers and hospitals. We need to keep people healthy in the communities where they live, work, and play. And today health systems are doing that by referring or redirecting patients into more appropriate forms of care, as well as decreasing the costs of those services. And they're doing that by building partnerships with community-based organizations. Some of the groups that we're working with to do this are health systems that do managed care and local governments. And we're helping them to leverage the community resources in their local communities, like primary health care, shelters, food pantries, and wellness centers. Our app keeps people healthy by informing them about what is actually available in the communities there, who's eligible for those services, and how they can access them. And it tells us, it helps case managers actually make quicker referrals, and more informed referrals, in fact, because they know exactly when things are opened, if people are eligible for them, that sort of thing. Some of the recent data that we've been using is from HRSA, thank you very much. We've been using some of their FQHC information. From CMS, we're using their nursing home data and DME, as well as from ACF, your refugee health. Thank you very much. So what we do is we're sourcing this information not only from these great resources, but also from our clients. And we're bringing it all together, and then we actually augment that through a community research process. Our research team is made up of social workers, all having case management experience. And they're contacting each and every one of these organizations to verify the information is correct, as well as to get that nitty-gritty detail that's not always available to us online, or even by making one phone call to an agency. And so through this augmentation, we're creating new data. And so we're not just consuming it, but we're making it public and available to other people as well. And so one example of this is a partnership that we have in Southern California with the Desert Healthcare District. And they're partnering with the Clinton Foundation. And through this, we are creating a data set specific to them, but all that curated data is then released back out into the community in an open referral format. And we believe we're adding value to not only our clients by doing that, but also to any individuals, researchers, and nonprofit organizations that would want to use the data as well. Thank you.